the greatest benefit of living regionally is that is the community. So people are actually able to be connected in Tamworth. Yes, in terms of the sport and work and the arts and the church facilities. We've got everything here in Tamworth. Tamworth's a smaller place. It's much quicker to get to work. If you're in town, it's 5 or 10 minutes drive to work, and then it's easy to jump in the car and head out to sporting facilities after work or the gym.
In Peel Healthcare itself, our senior doctors are always at hand to assist us as nursing staff. We work in a multidisciplinary team, so therefore we work together in a very cohesive environment. Tamworth has a current population of about 62,000 and surrounding areas, so it's not quite there to 100,000 yet, but that's the growth projection in the next so many years. So it's only 4 hours to the coast. It's 3 hours to Newcastle. It's an hour to Brisbane and Sydney by flight. There's some great areas around Tamworth, national parks. Housing is affordable, and rent is so much cheaper here. So the cost of living is definitely comparative to most country towns and far cheaper than the city areas.
So we're very fortunate in Tamworth. We recently had a new hospital built, and the hospital was built with the provision for the future, so that there was room to expand services that we didn't have at the time when it was built. And we're starting to see those services coming to Tamworth, which means our patients don't need to travel to Newcastle and Sydney. We've got a really good connection between the general practitioners and the hospital, doctors and staff at the hospital. We do things socially. We've got professional development and in-services that we will do together, dinners. There's plenty of opportunity for doctors at the hospital and in general practice to actually be able to move between sites as well. So we have some of our general practitioners from time to time do shifts in emergency or pick up some training opportunities, like with obstetrics, anaesthetics, so they'll do a day a week at the hospital. And we that connection will continue into the future. We don't have to be on call for the hospital, so that's a great advantage of being in a bigger regional centre. There's so much support here for training doctors, either first year out of uni or GP training, specialist training in Tamworth. So I did my undergraduate years in the tertiary hospitals in Sydney. Came here as an intern, and I've done all of my professional working life in Tamworth. I've done all of my training in Tamworth. In the tertiary hospitals in Sydney, the specialists might know your name while you're doing that term, but they've forgotten you as soon as you've left. There's not much of a connection there. In Tamworth, everybody knows each other. The specialists really look out for their interns, their residents. I played touch football with a couple of my consultants. We went to their houses for dinner. So there was the social connection as well as the professional connection, so that just made it a lot easier to be able to communicate with them, ask questions. They actually nurtured us and took the time and the interest in teaching us whatever questions we had. In terms of general practice, it's the same. It's not just Peel that have nurtured me and trained me. It's also the other practices in Tamworth, GPs, from other practices that have stepped in to offer support and advice. So I think that the support professionally from an educational point of view in Tamworth is sensational, very good.